Ready?
You're live.
Hey guys, it's Dr. Emer. We're in today in West Hollywood, and we are doing one of our gorgeous patients. We're just doing a little subtle enhancement. Like I always tell you, you always want to keep things plump and hydrated. The new look right now is not overdone, is not the lips that walk into the room before you do. It's the lips that they're subtle and natural and give a nice contour. She already has, if you take a look, come real close, she already has a beautiful lip shape. You can see perfect Cupid's bow, but look at, we have a little bit of wrinkles. There's a lack of the pinkness to the lip, and we just want some hydration. We want some life brought back. So what we're gonna do is we're gonna use a product called Restylane Define, and that will help plump it up a little bit, give it a little hydration, but also as she moves her lips, this is a mobile filler. It'll be moving with her, so it's less likely to lump or bump. The other thing we're going to do is just soften a little bump. We're going to do that very, very easily with a little bit of filler to the bridge of her nose, and it's just going to make it a little more slender and a little more sleek. So we're going to start at the bottom, and remember when we're doing lips, we're just a little baby injection. When you do lips, you want to go nice and slow, and you want to do very subtle amounts. Some people do this really quick. Personally, I like to take it slower. Watch, be very precise so we can see there's precision to the technique. We're using a very small needle. The other thing we like to do is do it in different layers. So there we just did a posterior layer. Now I'm doing an anterior layer. This is going to allow me to give her that sort of keyhole pout. That's a nice little softening. And with her lip, like even look at that, just a small bit. Look at the difference between the one side and the other. Now to kind of enhance it, we'll do a pillar technique. We'll go right up into there and we'll come down, do a nice little pillar. Same thing on the other side. Okay, and gives a nice little definition. Now we're gonna do that same thing over here, a little pinch, 1, 2, 3. Nice and soft. Nothing crazy. Because the look right now is to be full, but not voluptuous. So we're doing it in different layers here. We're gonna go right into the cupid bow. Deep breath, deep breath. Yeah, that's the area that's always the hurt me spot, a little bit. And then it's always good to come across that cupid's bow, enhance the other angle. Deep breath, you're doing great. Okay, and then what we're gonna do, we're gonna do a nice pillar in the column here. Even everything out, take a deep breath, breathe all the way out. It's gonna look amazing. See, we're just lifting. That's gonna help evert and give some definition. Perfect. So take a look. You can already see half the lip enhanced. We can draw a line right there, and you can see that there's a big improvement. Close your eyes. Everyone gets tears. A little bit of tears of joy. After getting lips. It always just happens. It just, we don't even know why. It just occurs. So we're going to come back here. We're going to avoid going too posterior in this midline, because we want to just keep it nice and even. We're going to balance out the lower a little bit. And this Restylane product is nice and soft. Take a look. We're going to keep that sort of keyhole nice pout. So we're just going to even that with a few pillars. We want her obsessed with her lips. Now the thing about her that's unique is even though her lip shape is long, the majority of the volume's in the middle. You don't want to elongate it and give her a Julia Roberts mouth. Even though it's pretty on Julia Roberts, it's not going to be pretty on her because it doesn't fit her facial shape. Little pinch at the top. And again, remember, we're going to follow that cupid's bow. Deep breath. Good. now we're gonna go again to that Cupid's bow to the pillar. We're gonna give a nice deep breath. We're gonna give a nice lift here. Good. And that gives some definition. You can see that right here. And gave us some shaping. Okay, hold on, I'll come back. Other side. Take another quick look. Open for me just a little bit. Just gonna even it out. Perfect. Okay. So with that little remaining we have, so I'm gonna give it a little bit more.
Someone said that they got fillers in their lips, but they didn't last.
Well, that can happen. Sometimes fillers are made of sugars, and just like you eat food, sugars dissolve, so they may not last that long. Or for the volume you're looking for, you may need more than a syringe or two. You know, that's the issue. We're going to go all the way down. And that's the issue, is maybe that person needed a little bit more, and they noticed the initial improvement was swelling. So we're just doing a little bit.
Is it true that fillers aren't supposed to last more than 6 months?
Depends on the filler. Like some fillers last much longer, up to 9 to 12 months, and some dissolve a little more quickly. This filler typically lasts about a year. Now she also wants a little upturn.
Do you offer training?
We do. We're having a training course in New York this week. If you're interested, email Cole at jasonmrmd.com. So what we're going to do, so you see we straightened that bridge a little bit, which looks great. And now what we want to do is just balance that by lifting the tip a little bit. So what we're going to do is switch over to a cannula. This looks a little scarier than it is. So we're going to do a needle poke right at the tip of her nose. One little pinch, 1, 2, 3. Bear with me. Sorry, honey. Go ahead and grab that for me. We're going to go right into those cartilages and go right into the septal area and give a little bit of support. Deep breath, okay? Good. Perfect. We're going to lift that tip just a little. You don't want to overdo it. Great. Okay. So now,
That was cute.
that's very cute. Okay, wipe and let's shower. Take a look.
Oh, yeah. Yes.
So what do you think now of straighter bridge and then look to the side a little bit?
See, because remember you said the focal point of the face is right here?
Mhm.
This is where the eye goes. So even making this a little bit thin, I noticed makes my eyes look bigger.
Right, so if we thin this out and then from the side we just lifted the tip slightly, it blended this bone, this bump that was there, this mild bump. And then now, look at the lip. We have some nice volume. It's a defined Cupid's bow.
Wow.
It's good volume, it's good definition, and obviously there's a little swelling, but once that all goes down, I think that's gonna look great. So the cool thing about this treatment, you guys, is these are focal points on people's faces, their eyes, their nose, their lips. And by doing just that little teeny bit, it makes a huge difference in how the people perceive them and how they perceive themselves. So she's gonna feel so much more beautiful and notice other things like her beautiful hair, her eyebrows, her eyes, and not focus on her nose and lips anymore because they're gonna be perfect.
Thank you.
You're welcome. Thank you. Bye.
Bye.
Let me see.
I love
That's
it.
really
I
good.
see. It makes such a big difference.
Yeah, it really does.
It really
Let me
does.
take a picture of that and then we'll do your
And these, I mean, this is outrageous how good you did this. I've
That's
never
awesome.
seen anything look so good in my entire life. Are people freaking out on the thing?